How does blood supply reach your thyroid gland? Imagine a busy network of highways delivering essential supplies to a vital organ in your neck. That organ is your thyroid gland, and its blood supply is a finely tuned system that keeps it functioning smoothly. The main routes are to primary arteries, the superior thyroid artery and the inferior thyroid artery. The superior thyroid artery starts as the first branch off the external carotid artery, which is a major blood vessel in your neck. It travels downward in a straight line to reach the upper part of the thyroid gland, especially the top and front areas. Once it arrives, it splits into smaller branches that spread out over the surface of the gland, supplying blood to the upper sections and the isthmus, which is the thin tissue connecting the two lobes of the thyroid. It's important to note that this artery runs close to the external laryngeal nerve, which surgeons need to be careful of during procedures to avoid nerve damage. The inferior thyroid artery comes from a different route. It originates from the thyrocervical trunk, a branch of the subclavian artery, which is a major artery that supplies blood to the arms and neck. This artery moves upward and medially toward the back of the thyroid gland, mainly supplying the lower parts of the gland. It divides into several smaller branches that penetrate the lower pole of the thyroid, nourishing the tissue there. During thyroid surgery, surgeons must be cautious because the inferior thyroid artery is closely associated with the recurrent laryngeal nerve, which controls your voice box. Preserving this nerve is crucial to prevent voice changes. In some people, a third artery called the thyroid IMA artery is present. It is found in about 3% of the population and usually arises from the brachiocephalic trunk or directly from the aortic arch. This artery supplies the middle and front parts of the thyroid, especially the isthmus. The arteries form a network of connections, called anastomoses, which create a rich and redundant blood supply. This extensive vascular network supports the thyroid's high metabolic activity and hormone production. Venous drainage from the thyroid complements this arterial supply. Blood from the thyroid drains through the superior, middle, and inferior thyroid veins, which empty into larger veins like the internal jugular and brachiocephalic veins. This efficient blood flow helps maintain the gland's health and function. Understanding how blood reaches the thyroid is especially important when considering thyroid disorders or planning surgery, as damaging these arteries or nearby nerves can lead to complications like bleeding or voice problems. The abundant blood supply also highlights how vital the thyroid is for regulating your metabolism and overall health. Always remember, if you have concerns about your thyroid, consult a healthcare professional for personalized advice and proper evaluation.